Hi, I'm Daniela Rossi and I am a clinical psychologist. So what led me to become a clinical psychologist? I would say there are many reasons behind my choice, but I can summarize this perhaps in looking at two main factors. One is emotional and the other one is intellectual. So from an intellectual viewpoint, I've always been fascinated by how mind and body work, and also intrigued by the complexity and diversity of emotions and human behaviors. As a person, I would say that I've always been a sensitive individual since I was a child, therefore captured by existential themes in life and aware of human suffering. Therefore, growing up, I wanted to contribute to alleviate this suffering by addressing some of the causes. For example, ill health, social injustices such as inequalities, discrimination. In my work with clients, my aim is to help them to develop psychological flexibility, which is a range of skills required to make the adjustments necessary to live a rich and meaningful life, for whatever rich and meaningful may mean to people. And to achieve that, I use evidence-based approaches, knowledge, skills, and a wealth of experience developed over years working for the NHS and the private sector. What I value most about my job is, first of all, the opportunity to work with people from all walks of life, then being entrusted by my clients to help them with issues that are very often complex and difficult to discuss. Then the opportunity to create a space where people can feel safe, heard, not judged, and cared for. And finally, the opportunity for continued professional and personal development. What my clients value most about my work and what I value most about them? Well, the first part of this question, I think that would be better if asked directly to my client, but I'm happy to share with you feedback that I received over the years about what clients find beneficial about my therapy, which is my approach that is compassionate, respectful, direct, cooperative, and humorous when appropriate. Then my treatment that is tailored for my client needs, personal background, gender identity, and sexual orientation. What I value most about my client is their openness, their trust, their kindness, and above all, their courage. The courage to be vulnerable that is required when we enter therapy. This is especially true when, for example, the client might have had previous experience with a healthcare system where he may have felt let down. Also, dealing with the uncertainties in therapy or making changes can also be difficult for client. So therapy can be, very often is a beautiful journey, highly rewarding, but at the same time can be challenging. It definitely sometimes is challenging, at least part of it. In my work, I don't use mantras or catchphrases, but I love to share with my client a quote from the emeritus professor of psychology at Massachusetts University, John Kabat-Zinn, who is also the pioneer of the world-renowned mindful-based approach to therapies. And the quote goes, "You can stop the waves, but you can learn to surf." And I believe this quote to be a beautiful and poignant metaphor that can teach us how to deal with challenges in life. And with regard to my therapy, I think it's a beautiful, like a really summary of what type of therapy I provide, what the client can expect in a way, to learn to ride the waves. This is because mindfulness is a very important aspect of most of the therapies I provide. Of course, when I do work as a clinical psychologist, I have many passions and interests I pursue, but I would say this alongside, in fact, clinical psychology, that is one of my biggest passions, as you may have understood at this point. For example, I love art, design, fashion. I love humanistic sciences. I always been, and I am, deeply interested in philosophy, religions, comparative religions, and spirituality. I am an Ashtanga yoga student and mindfulness practitioner, and I profoundly value and love my practices. And of course, I enjoy spending time with people I love.